I'm Dr. Cornelia Franz with the Franz Center.
And I'm Dr. Khalaf with Acupuncture Fit.
And we have missed doing our Facebook Lives together, so we are doing it again today because one of us was in Europe having a good time. And so it wasn't me. All right. So we had such a great time talking about anxiety that we're going to do more on anxiety today in hopes to just continue to enlighten you and help those with anxiety problems. Anxiety, to me, is an acquired problem because we're really not born anxious. And so it is acquired. Sometimes there's a genetic predisposition. There's definitely a food predisposition when you eat the wrong things. And then there is just society. We were growing up in a time of truly TMI, too much information. Our kids have more information at their fingertips than most of us had in our lifetimes. And so what are some of the triggers? Some of the triggers can be like Dr. Google, one of my favorites, commercials on TV, and just a general discomfort, you know, with life, and you need to do more, be more, go more, all that kind of stuff. And so a lot of stuff has just gotten really just out of control. And we have more kids with anxiety today than we've seen ever before in any other generation. And so when you begin to look at it as an acquired thing, then we can unacquire it. And there are tools we can do. So, there's a lack of common sense is also another reason people have anxiety. And I'm going to give medicine a little bit more thing. You get a paper cut and you're like, oh my God, it's going to get infected. I have flesh-eating strep. No. Common things are common. Remember that. We in medicine, we say if you hear hoofbeats, think horses, not zebras. So common things are common. So don't jump off into the, oh my God, this is the most horrible thing that's ever happened, because it probably is not.
Right.
And really anxiety is just another form of dysfunction and imbalance. And we have tools that can help you get rebalanced. We have acupuncture. Duh, I'm here with an acupuncturist, okay? We have homeopathy. It's what I do and what our practice does. We have, nutrition. We have meditation. You have breathing and massage. I mean, there are so many tools that can begin to restore function so you don't feel that way. And so, then we have Western medicine. I mean, there's always the pill, okay? And most people who take them, for some people, it's a lifesaver. I don't ever want to diminish that. Once you've had your life saved, though, let's go about restoring function so you don't need the medication.
Right.
And there are times people just have major panic attacks and even psychotic breaks from anxiety, and medication does help bring them back to function. But then let's go after the heal, HEAL.
That's so good.
Okay.
I think of this as a pathway. So we'll get thrown off a pathway that we're on. Medicine can help bring you back on that path, but if that path was the same path that you were on before, you're going to get thrown off on that path again.
Right.
And it's all about restoring pathways and functions. That's beautiful. That's brilliant.
Right. And so one of the big things that people complain a lot about is insomnia with their anxiety. And so tell us about that from your point of view.
Yeah, and that's one of the conditions or symptoms that I see oftentimes when somebody checks anxiety on our intake form. It's about, I'd say 90% of our patients check off anxiety on their intake forms when they come in. Coupled with that are a couple of different things: fatigue, lack of clarity, but more often than not, I see insomnia. And insomnia and anxiety have a bi-directional relationship, because if you don't sleep well, you're definitely going to be more anxious. This impacts emotional, mental, physical health, and it's almost a catch-22 if you're not sleeping well and you're trying to overcome anxiety. And I really want to hone in on that on this live today. And by the way, if you're watching this and you like what you're hearing, hit that like button, hit that share button, and share this with your friends and your family, because we just absolutely love and are passionate about simplifying your health and focusing back to anxiety and sleep specifically. The first point I want to make regarding this is to exercise and when to exercise, right? So exercise brings what? Blood flow, and an increase of blood flow in the body, which brings nourishment to your brain. Blood always flows in the body in the directions of the most vital organs. So oftentimes when blood isn't flowing properly, it's not coming up here to our brain to nourish it, to help us fall asleep at night. So how do we do that? Point number one is exercise, but it's also very, very important to note that when you're exercising, you want to exercise in the morning and in the afternoon. You never want to exercise late at night. As a rule of thumb, I tell all my patients, cease all exercise, all physical activity by 8 p.m. at night, because our bodies have to go in circadian rhythms to help themselves, gradually fall asleep, to help our brain gradually shut off. So I recommend to all my patients to stop exercising anytime after 8 p.m. at night.
Yeah. Now, exercise can vary for people too.
Yes.
Because I'm listening to you and my mind is immediately going, oh, I don't want to do that. Oh, I don't want to do that. And you know what? That's a conditioning thing. What are you really saying? I'm like, I am not going to run. And he didn't say that. He just said exercise. So it's going to vary for different people. And one of the things that we stress at the Franz Center is getting your body type.
Yes.
Now, also, each body type has exercises that are best for that body type.
Right.
And the exercises, and I love the research as it's coming out, because it actually continues to just validate what acupuncture and Chinese medicine is known for 6,000 years. Exercising doesn't have to be, killing yourself at the gym.
Right.
And taking a walk, all right? I mean, gardening, sitting, singing is an exercise for some people. Pilates, so it's no hardcore exercising late at night, because it can mess with you, but it's really kind of about movement.
Mm-hmm.
Oh, and I have to interject, totally off topic. I'm so
Sure,
sorry.
no, I love it.
All right, so when you've exercised too hard and you've hurt yourself, Western medicine for years has said RICE, rest, ice, compression, and elevation. I just came across 2 articles in the last week that they are abandoning that. Oh. Because you know why? I know you know why.
Why?
No, you know why, okay? Because the ice causes constriction and reduces blood flow to the area. And when you reduce blood flow, you reduce the healing, and you reduce the lymphocytes and the macrophages and all the things that take away the toxins. Anyway, and so they're moving to more heat, which you guys have known forever. Mm-hmm. And I just laughed, okay? Because I'm like, all right, great. So when you are hurt when you exercise, okay, you can use Revive, which we have, Traumeel, Arnica. I mean, there's so many different things you can do. And warmth, okay? It'll make it swell more. Actually, it doesn't. Because of the blood flow to the area, it can remove the damaged stuff faster.
It's so true. I mean, even with acupuncture and cupping, we can bring blood flow to the area, and blood flow brings nutrients. And I know you said a lot of big words with macrophages and such. It's basically bringing nutrients to the area to help reduce inflammation. I love it. No, that's great. And that's what we're doing, because, medicine a lot of times can be up here even for my head. And I've learned so much from you, Neely, and Dr. Franz, And it's amazing, when we bring it and simplify it, clarity is the greatest accelerator, we believe. So that is a very, very good point regarding exercise. So exercise is preferably in the morning and afternoon. And if you don't know what exercises to do for your body type, we can absolutely help you with that. Come into the Franz Center and get body type. Secondly is your environment. And I preach this to my patients all the time. If you're not sleeping well, the very first thing you can do that is free is dark, quiet, cool, still, no TV, no fan is the way you should set up your room when you're sleeping at night. Yeah, very, very important.
And no computer in the room.
Yes, no computer in the room. All of the things that I just told you to turn off, such as your fan, and Dr. Franz said to turn off, the computer in your room, it's causing such stimulations in our body that our body can't rest. I'm going to hone in on one of those, which is the fan. And this is my favorite, because I tell patients to cut off the fan to help themselves sleep better at night, and they look at me like I have 2 heads. Well, I'm going to explain that real quick. If you cut off your fan, this is what's happening. When wind is blowing on your body, it's causing our pores to close, because our body naturally protects itself from something if it feels it from coming in. So when our pores are constantly doing this at night, our body's not truly resting. By cutting the fan off and not having any motion or even stimuli or sound from a TV, our body can get in a true state of rest. So I just love that tip, because a lot of people, have their fan blasting. I mean, you can have 100 tower fans in the room that are quiet, blowing wind every which way, but if it's touching your body, it's not beneficial to help you falling asleep and helping your anxiety. So,
and wind invasion is a big Chinese thing.
Absolutely. We believe that wind can enter the pores, drying the fluids that lubricate all sorts of functions in our body that cause us kind of to become like the Tin Man. So
Right. So when you wake up and you're like, what happened? Well, you kind of got dehydrated at night.
Right.
And you know what? I love that because you guys have known it for years, and now we're learning. But your grandmother knew it.
Right.
And your great-grandmother and your mother. Don't go out with your hair wet. Don't
Correct.
go out with your hair wet in the wind. You'll get sick. No, I won't. Yes, you will. Because of that. Even homeopathy has it. Croup, the can be caused by a dry west wind. Okay?
Interesting.
Yeah, so you go, well, were you out when it was, windy the other day? Yes, and when it blows here,
Right.
it can cause problems.
So I would assume then parents, if you're bathing your kids, make sure to bundle them up. Make sure that when you lay them on the bed to change them, they're completely dry. Your AC vent's not blowing on them. The fan's not going on. Dry environment to help, prevent, among other ways, croup, etc. So
Right.
we could do a whole nother live on that.
I know.
So back to my third point on how to sleep better to improve your anxiety is no drinks except for
Water.
Exactly. No drinks except for water. An increase in caffeine, especially from Red Bull to Coca-Cola or any of the soft drinks out there, will increase your heart rate, will in turn increase your anxiety, which will decrease the amount and quality of sleep that you get.
We all know when you're tired, you don't think right.
Correct. Correct. Fourth, or go ahead.
Have you ever been so tired you're numb?
Oh, yes. Yes, almost zombie-like.
Yeah.
Kind of just going with the flow.
Yeah. You just know. You know you're conscious. You know you're doing it. I mean, you didn't rest.
Thanks, medical school.
Yeah.
And life in general. So, fourth point is a calm mind is going to help you sleep better. And there's some points and methods that we can use to help calm your mind. One of which is breathing exercises, and that's a big part of body typing.
Yes. It's a big part of life.
Exactly.
Breathing is fundamental.
Absolutely.
But deep breathing triggers the parasympathetic system, which is the system that calms the body. When you breathe deeply, your body has to calm down. And there are a lot of YouTube videos out there. I sat in YouTube one day for hours on a day off, just looking for like meditation and breathing videos that were very helpful. But the breathing part, and I know of people, somebody was telling me a story of somebody with super high blood pressure in the ER. And while they were off, getting all emergent stuff, the person with them goes, just breathe. Just breathe. No, just breathe. And the blood pressure started coming down. Just breathing.
That's amazing.
And yeah, it really is. And so, never underestimate the power of breathing.
Absolutely.
Same principle is count to 10. Well, yeah, you count to 10, but part of that when your mom and grandma says it is so you'll actually breathe. So, because calming the mind, a lot of people out there, I think you're going to say, my mind just races at night. So again, these are different techniques. There actually are homeopathic remedies that can help. There are exercises, not the hardcore we were talking about, but other ones like your body type exercise actually that can help reset you. So this is it's incredible information, and you used the best word earlier, free. Okay, some of these things are free, and you just can do them anywhere.
And that's why we're on here. Hopefully,
right.
Everyone, you're enjoying this, and you're gaining knowledge and clarity on, if you're not sleeping well, and maybe this is, leading to your anxiety. Come on in. We'll be more than happy to have discussions with you at our offices. You can message us right here on our social media pages. And I do have to bring up what we practice in our office at Acupuncture Fit, which is acupuncture.
Right.
And our specific technique is a scalp acupuncture technique. And at my practice, we don't use needles. We use instruments. There's a big difference between a hypodermic needle and an acupuncture instrument. We've got a lot of information on our Facebook page there. But acupuncture, specifically scalp acupuncture, can help induce blood flow to the brain, calming our minds, causing us to be able to sleep better, and in turn, reducing our anxiety. So,
what about essential oils?
Oh, essential oils. There are so many essential oils out there, but you want to use the right essential oils, right? So some of my favorites are lavender. Now, lavender is very estrogen dominant, so I do recommend using it for more female patients than male patients to help to calm the mind. I've noticed that more female patients will like lavender because of that, and more male patients will shy away from that.
Oh, wow.
Yeah, very, very interesting. Now, if there is a male that needs to sleep better, I recommend a lavender blend, so it kind of balances that out. But lavender is my favorite to help sleep, or a lavender blend to help sleep.
Yeah, you can diffuse it. One of my favorite techniques, though, is putting it on the feet.
Yes.
That goes through a lot of different healing modalities, because when you put stuff on the feet, it draws that energy down.
Correct.
And anxiety and the things we're talking about can be just too much up here, and so you want to pull it down, and then it goes out.
Great. I love that technique.
We
Very
do it
grounding.
on kids. Yeah. You know, we've done it for, again, sidebar, we've done it for fevers with like garlic and onions, and, you know, even fevers even. I mean, I have river rocks, and learned from another acupuncturist, you take the river rocks, put them in the fridge, and then you can put them like on the feet and put socks on them, and the cold draws the fever down.
That's amazing.
Yeah.
That's amazing. So if patients are having trouble sleeping, or their kids are having trouble sleeping, what's the protocol to use lavender on the child? Do they just apply the drops at the bottom of the feet?
Yes, I'll use like 1 or 2 drops with a carrier oil and then rub the feet.
Excellent. What's your favorite carrier oil that you usually recommend?
Oh, it just varies, because everybody, coconut oil, olive oil, jojoba oil.
Great.
Okay.
That's great. So just a little bit of a carrier oil, 1 or 2 drops of lavender, and then you just apply it to the bottom of the heat to help improve sleep, which in turn is going to help reduce your anxiety.
Right.
And one of my favorites that I talk about with my patient all the time, because we're surrounded by it all the time, and you're actually surrounded by it right now as you listen to it, and we can't get away from it, is limit screen time.
Right.
Very, very, very important. By watching screens at night, and I'm, a victim of that. I know you've got a story about a laptop, I think,
Yeah.
but it increases our anxiety, increases our thoughts, it stimulates our minds, and it doesn't help our brain activity turn off before sleeping. So turn off those screens.
Right, especially with your kids. They really need it limited. I don't really recommend it, but some of you have done it. You just weren't paying attention, and your child's played video games, even non-violent ones, for hours, and then they're just grumpy. Oh yeah, it messes with your neurotransmitters.
Absolutely.
It really does. So yeah, limiting screen time. And yeah, the story was I had the computer in my bedroom, and it was great, because when I got up in the morning, I could pop out of bed, sit, do some computer stuff, and I wasn't sleeping. And I sleep. I mean, I fall asleep sitting up sometimes, And so when I just moved the computer out of the room, that was the only thing I did. That very night I slept just fine. So the EMFs, people know the electromagnetic fields. I mean, and some of this stuff exuding, and you've got your phone, your TV, your computer, all this stuff in your room, it's counterproductive.
Very counterproductive.
Yeah.
Yeah, the best thing to do is just limit the screens, put them in another room, turn them off. Get an old school alarm clock, even if you use your phone to wake it up. So, now, most importantly, we're giving you all these tips, and there's a reason why anxiety is so prevalent in our society, and I firmly believe that one of the reasons why it's very prevalent and people are not going in or seeking help for this is because it's very hard to realize a lot of times that you have anxiety, because that's just normal, or that's how I've always lived my life. Now, and I'm getting to a point, a little bit of anxiety is healthy, because what does it do? It helps us work.
Right.
But out of balance, it's not. We get knocked off a path, like we were talking about earlier, and we have to rebalance that. And we get a paper cut or any severe disease, it's really easy to point to that and say, I need to go get help with that. Where anxiety, it's a lot harder to do that. So what we recommend, if you're noticing symptoms of your anxiety, this is very, very important. Ask for help, whether it's mild, whether it's moderate, whether it's severe. You want to ask for help, and there are ways to do that. You can call our offices to get help, but one thing that I really, really like is to have an accountability partner, right? Somebody that recognizes that you have an anxiety, maybe a close friend or family member that you can, counsel with, right? So I think that's very important to help, the process of overcoming anxiety. Seeing a natural doctor, seeing a medical doctor, and having some licensed mental health counseling as well. We have a great Rolodex of licensed mental health counselors where counseling can be simply done over the phone or over Skype if you don't want to see somebody face to face. And we have some wonderful licensed mental health counselors here in Central Florida that we refer to as well for some talk therapy. So
awesome. If you're into more self-help, I always have books that I've read or can recommend, and I have 2 today that I'm going to recommend. One I actually have here. It's called Crucial Conversations. This is not about anxiety, but for a lot of people who have trouble with conversations, this is an amazing tool because most people don't like conflict. And so when a conversation starts to get a little tense, we all have a way of handling it. Like we either withdraw and just shut up, or you go, okay, well, how about when you did this? All right, you know, or you lash out. So, but this book is such a great book of information and tools on how to have these conversations and how to recognize some of the dysfunctional patterns people do. Like a lot of people are immediately, you know, I go, well, you know what, Anise, it's always your fault. Every time this happens, it's your fault. Well, I'm not being accountable, okay, because I had a role in it. So I'm making you the villain and I'm making me the victim. And then a third thing is that people are like, this is how I am, I can't help it. No, you can. So I highly recommend this book for learning how to have strategies to talk to people. The other one is called Daring Greatly by Brene Brown. She is a shame researcher, and she's been doing it for 20 years. It's incredibly powerful.
Love her.
Yeah, because it's when you begin, because some of the shame can cause anxiety. All right, and there are a lot of techniques people use, and I know we've used it in Western medicine. You know, it's like, well, you're just a bad mom, you're just a bad parent. You know, you're just bad, and it's like, no, nobody's bad, and so they're shaming you into getting you to do something. And so I haven't finished that book yet, Daring Greatly, but it's awesome. She talks about having to be shame resilient. And so because everybody here is amazing and powerful and gifted. And so let's work, as we always say, let's work together.
Yes.
Instead of against each other. So, you know, here's a lot of good tips today on how to deal with it. And you always have support. And you can have the support you want. If you want Western medicine, that's there. If you want acupuncture, wow. If you want homeopathy, you know, nutrition, all of these things, exercise, because it's not always one thing that's going to fix it. It'll just it's changing your mind, changing how you think, and changing your lifestyle, and not letting everybody else tell you who you are. Because they don't know.
They don't.
No.
They don't. We never know what somebody's going through. Try to remember that, you know. Next time maybe somebody's grumpy towards you, or a friend or family member is disagreeing with you. Who knows what they're going through deep down inside. And as physicians, we're on the receiving end of it. We really are. And it's each and every one of our responsibilities, myself included, Dr. Franz included, to be positive with people, to use manners with people.
Manners. So forgotten.
What are those?
Manners. They're so important.
Yeah. Please and thank you go a long way.
Being kind, you know, just helping people.
Yeah. So hopefully what we've talked about today has sparked something in your life, changed something in your life, or maybe you're thinking of somebody that you can help overcome anxiety, whether it's helping them sleep better, whether it's being there as a friend. And again, if you have any questions at all, any concerns, feel free to message us. We'll answer you personally, or we'll have somebody get us the question and get back with you very quickly and as soon as possible. So
yeah, so you're not alone on any level. You're not the only one with the issue, and you have plenty of people who will support and help you and get you through it so that you can enjoy life.
Enjoy. That's going to be my word going into the weekend.
Yeah.
Thank you so much, Dr. Franz. So I really appreciate everybody watching and supporting, and all the comments coming through, and the sharing and the hearting and the liking. Please spread this message out to everybody or anybody that might need help with anxiety, specifically sleeping better, to help improve their quality of life. And thank you so much for listening to us again and helping us help you simplify your health. I hope everybody has a happy and healthy weekend.
I know.